brothers, good morning. And I just want to thank you, Jerry, DVP Thornburg, State President Malin Mitchell, and of course, the sisters and brothers who are on right now. I'm John Nemec, Deputy Director of the Occupational and Behavioral Health Services within the Occupational Health and Safety Medicine Division. And we are joined today by our COVID-19 team, and I'll allow my two colleagues to go and actually introduce themselves.
Hi, good morning, everyone. I'm Rob McClintock. I'm the Deputy Director for Fire and EMS Operations and part of the COVID team here. Raquel, go ahead.
Good morning, everyone. I'm Raquel Siegel, and I'm the Occupational Health Specialist under the Health and Safety Department at the IFF. Nice to meet you all.
Great, thank you, Raquel and Rob. Jerry, I know I had said this last time to State President Malin Mitchell, but I want to just echo it again very loudly and boldly. You literally rock. You're constantly reaching out, looking for the advice, looking for those answers. And there is no question in anyone's mind that you are always out there advocating for your members, your sisters and brothers in the great state of Wisconsin and as far as the 5th District. So, brother, keep up the great work. You're doing outstanding work. But as it relates to a whole host of things, and I'll get in, actually digress here briefly, and I'll turn it over to both Raquel and Rob. But it's extremely critical that our members are protected through the vaccinations to maintain the readiness to respond to the COVID-19 and other emergencies. And let's not forget with what we're going through right now, that we're not only dealing with the COVID-19 virus, but we're also faced with this thing called the flu. So the IFF has advocated for dealing directly with the federal government. The firefighters and EMTs, paramedics do receive the top tier priority when it comes to, whenever the vaccine is really, when the vaccine actually becomes available. As far as the CDC is making recommendations to the states that are members be, dealing with amongst, the first to actually receive the vaccine. We know, I know the fact that unfortunately with what the CDC had said last week, and we're firefighters, we're EMTs, we're paramedics, we're healthcare workers, and the list just goes on and on and on and on. But through our GP, there was a letter that was sent to the National Governors Association advocating that the IFF members, albeit firefighters, EMTs, paramedics, that they be, actually placed in tier 1A. We found out, as far as yesterday, that FDA did approve, this first vaccination from Pfizer. There still needs to be additional rollout on that. There still needs to be additional information, as it relates to that. One of the major issues that we see is that unfortunately there's not going to be enough vaccine, obviously not to look at everyone in the US, but moreover, making sure and ensuring that our members, our firefighters, our EMTs, our paramedics do receive not only the first shot, but subsequently they're able to receive the second one, within those 21 days. Piggyback on that, this second vaccine, Moderna, that's supposed to be looked at, reviewed by FDA next week. And let's be very, very clear here, about these vaccinations, that while they're going to be receiving EUAs, emergency use authorizations, we are advocating that our members receive, this vaccination. And what's forthcoming, and I'll allow Rob and Raquel to talk more about it, but what's going to be key is education on this vaccination. When fire chiefs send out SOPs, SOGs, that you should do this, all this other stuff, if only they would educate why, you know, X, Y, and Z, why this SOP, why this SOG is actually being enforced, and why it even was, you know, actually sent out. So education and advocacy is going to be extremely key. We're hearing from other departments, other sisters and brothers, that not only are they not going to get the vaccine, but, you know, they're saying, hell no, I'm not going to get the vaccine. But it is extremely, extremely key, from our mouths to your ears, from your eyes to you know, to the screens, to the papers, that this COVID-19 team is going to actually produce. It's going to be the education, and it's going to be, you know, as far as the overall advocacy. Also, please keep in mind that not only, you know, dealing with the COVID-19 team, we are coupled with our doctors from Johns Hopkins University, along with our physicians who part of the Wellness Fitness Initiative. So not only are you getting information from the CDC, from this, you know, COVID team, but you're also receiving the information from these other medical professionals. Robert Kell?
Yeah, I just want to echo the sentiments that we, you know, we're in favor of our members getting the vaccine, but not only for your protection, right, but the protection of your family members, friends, and citizens, and people that you may have in the vulnerable population. If you're a caregiver or anything like that, it's important because, you know, we want to try to protect not only our members, but our members' families and friends as well. Jerry, I believe your doc joined. It might be better at this point to turn over and let him talk about the vaccine a little bit more in depth of what he knows and side effects and things of that nature. If you'd like to do that. Or did he not join yet?
All right, I was just scanning to see if he did in the list here. But I do have another extremely educated and great friend doctor online that would be able to comment a little bit more on the I guess what's going on here in Wisconsin. Dr. Weston, would you be able to join?
Sure. Good morning.
Good morning.
I'm speaking, so I'm not in a great location, but I'm happy to talk. Good morning, everyone. And just Jerry, I did hear from Dr. Kola. Yes, he may not have the link, so if you forward it to him, I think he'll jump on as well. But so I'll tell you what I know, which is not. Sorry, my name is Ben Weston. I'm the medical director for Milwaukee County Office of Emergency Management, and have been helping with coordination of the COVID response in the county. So what we know so far is somewhat limited, and some of it's been discussed already. So the Pfizer vaccine received EUA yesterday, emergency use authorization from the FDA. It's expected to start rolling out soon, very soon, like in the next week, for 1A recipients. As said, Moderna will be reviewed next week. There's no reason to expect that won't be approved as well. Vaccine volumes coming to Wisconsin specifically are expected to be around 65,000 doses. So those come in the two-part doses. So there shouldn't be at least any concern of somebody receiving the first dose, but then not having the second dose. So when you receive the first dose, your second dose is held for you and kind of reserved for you. So 65,000 individuals that can be vaccinated fully. Obviously, I'm sure everybody on this call is well aware of the confusion, perhaps is the best word, between EMS providers and firefighters, and that the CDC stated EMS providers are tier 1A and firefighters, I believe, are tier 1B, so a lower tier, which leaves a gap for fire-based EMS, which is the large percentage of our firefighters and EMS, or a large percentage of our EMS providers nationally, certainly, especially in more populated areas. So the SDMAC, which Dr. Colella, when he jumps on, can discuss, because he's on it as well, which is the State Disaster Advisory Medical Committee, I believe. It's going to advise on those levels of rankings, and there's been a lot of advocacy locally from our end, and then I know from the IAFF and more generally to have fire-based EMS be the top tier provider. Obviously, you are a high-risk, vulnerable population due to interacting with often undifferentiated patients and often known COVID patients in far less controlled environments than I certainly do in the emergency department, and other hospital-based providers do as well. As far as side effects of the vaccine, looking at the trials, which of note have been in tens of thousands of people. These are large trials. It's not just a couple hundred people, but looking in these large scale trials, there are side effects, just like there's side effects with any vaccine, just like there's side effects with any medication that you take. But the side effects seem to be mild. They seem to be mild compared to other vaccines even. So of course you're gonna have a sore arm, just like you do when you get your tetanus vaccine, when you get your flu shot. That's the most common one. I think it's around, I don't have it in front of me, I think it's around 80% of people get a sore arm. The other common side effects would be body aches, would be headaches. Those are the two most common. Some people get mild fevers, some people get some nausea, but almost all the side effects are fairly mild, and almost all the side effects have been shown to resolve after a day or two. And so, of course, it's an individual decision. It's a risk-benefit decision, but the risks are these fairly mild side effects, as opposed to, of course, the risk of getting COVID. And it's worth noting, I think, for providers, we talked about that education piece, and that obviously a lot of firefighters are very healthy people, and they're young. And so it's important to note that even in young, healthy people, are you likely to be hospitalized? No. Are you likely to die from COVID? No. Are you likely to transmit it to others? Yeah. But you're also likely to have long-term side effects. And so about 40% of people age 18 to 35 have long-term side effects after getting COVID. They have chronic headaches, they have chronic fatigue, they have chronic muscle aches for months out from COVID infection. That's for healthy 18 to 35-year-olds, and that goes up as you get older. So certainly I feel, and I think a lot on this call feel, that the benefits far outweigh the risks of getting the COVID vaccine when you consider the alternatives. So that's a quick update. I'm happy to answer any more specific questions. Thanks, Trey.
Hey, I appreciate it, Doc. And now our medical advisor, Dr. Kalala, is online as well. And you have the floor, sir.
Yeah, thanks. And sorry for the late add-on. And Dr. Weston, thanks for that fantastic summary. I think, you really said it all. The other piece I wanted, and we've talked about this before, the other piece that's important for young, healthy folks who get COVID is the cardiovascular side effects that may happen, things like myocarditis and heart failure. And these are the things that are career ending. So, whatever we can do to mitigate that is important, of course. And, as Dr. Weston mentioned, right now the vaccine is not a mandatory vaccine. I think the data is looking pretty good that this is safe. I plan on certainly being as close to the front of the line as they'll let me. I was just listening to some of the data this morning about the numbers of people that have been in the trial. It's been over almost 50,000 people in the Pfizer trial in about 7 countries across the world, 8 countries across the world. So, I think there's good representation. Yeah, I guess I would just probably leave it at that and take any questions that anybody has.
Thanks, Doc. Can you tell us a little bit about the SDMAC and where we started and where we ended, and what the likelihood is of the end game here for us being 1A?
Absolutely. Well, you are 1A. So, to be clear, from the beginning, ACIP is the committee that helps guide the CDC. So they've identified EMS as a 1A recipient. And they also identified firefighters as a 1B in the critical infrastructure population. But I think the clarity around that is not really understanding the nuance that most of EMS care delivered in a lot of the country is fire-based EMS. So really the advocacy that we did through the SDMAC and the vaccine subcommittee, both of which I sit on, is really just helping to shine light on EMS is delivered through fire-based delivery models like we have here in a good part of Wisconsin. So really it was just a clarifying discussion. So how I would like you to think about it is, if you are an EMS provider, whether you are on a fire engine or if you're a law enforcement agency agent who is part of a patient care facing delivery model, that is EMS. So you are going to be in that 1A tier. I think there's a couple nuances that are important to understand. So the bucket of 1A now includes long-term health care residents and providers. So I think the overall numbers of people that are in the 1A tier are going to be a lot higher than they were 4 or 5 weeks ago. But regardless, we are going to be in that 1A tier. I think the risk that EMS falls into, and a lot of other unaffiliated healthcare providers, which is the CDC designation, or at least the state designation. So this is people who don't work in the traditional hospital health system. So those are called unaffiliated. And just, like it or not, how a lot of this delivery is going to be done across the country is through organized healthcare. So, the big health systems, you all know them. Part of their charge will be to also be responsible for helping to vaccinate people outside of their walls. And the decision on the allocation that they get, part and parcel will be their commitment to vaccinating, others in the community that are affiliated healthcare workers. So I think, I guess I'm a little, how do I put this politically? I am a little skeptical. I want to make sure that we are at the table. So, ways that we can do that include setting up our own vaccine program, which, we intend to do, and some places across the state are doing that. 2 is partnering with your health departments to to clearly identify yourself as a 1A candidate. And then also to work with health systems to make sure that they do their transparent part of vaccinating us as well. So, I think those are some of the things. The other thing is, realistically, there's been a lot of attention focused on the Pfizer vaccine. But I really think that we, including like me in the emergency department, are going to probably be getting the Moderna vaccine more than the Pfizer. I think just the numbers of vaccines that are available, I think by the time it trickles across the country and then, into all of the 1A buckets, I think we're going to be seeing Moderna most likely. But, regardless, we'll be ready for whatever vaccine that we get. So does that answer your question, Derry?
Yeah, I think it definitely sheds light on it. So then now it goes to our DHS, then to the governor, and then for some reason, Wisconsin Republican Assembly wants to take a look at this thing and make sure they agree with all the scientists, right?
Yeah, I'll be absent to the legislative oversight proposal because that's really out of my wheelhouse. But from the science end, and actually, for your information, the vaccine group and the SDMAC approved all of this. It's on the public website for comment, and I believe the comment for the SDMAC may close either this Friday or early next week. I forget. It's on their website. But again, clearly identified, fire-based EMS is a 1A recipient.
And if we've already delivered public comment to the vaccine subcommittee, and you've made that recommendation to SDMAC, there's no need for us to do it again, correct?
Yeah, and actually SDMAC unanimously voted on the recommendations from the vaccine committee. A couple little minor like wordsmithing tweaks, but no, I think there's not really, and I don't think there would be additional value in commenting. But I would just encourage you, just do your diligence to take a look and make sure you're comfortable with the final document.
And one of the issues that we've had, even just with being notified of exposures that we've had through health departments, have been the the health department leadership in the different counties throughout the state, if they don't get the memo, or they try to push us to the back of the line like they did, definitely in the early stages of COVID, when we were trying to keep our members safe, who do we reach out to at that point?
That's a great question. So I think, I don't know what here's where I think it's also going to be challenging, as I mentioned before, and that is, all of this is going to be recommendations. So, the CDC gives the states recommendation, the states give recommendations to the vaccine providers. So, whoever those entities are, when you get the supply of vaccine, you get a list of the recommendations, which includes, the tiers and the job titles and all those things. Truth be told, there's going to be no, I don't know if there's a mechanism in place to go back to a health system and say, okay, you've received 1,000 doses of vaccine. Let me see who those 1,000 recipients are. So I think, so I don't have a good answer on I think the DHS would be the mechanism to report any concerns that you're not getting access to. And I think this should be from in this group. I do think that there should be some good attention around, who's getting vaccine and who is not able to get vaccine. Understanding there's going to be inherent delays in getting it. That's all of us are going to be in that bucket. The question is, if vaccine's available and somebody says, well, we're going to not give you this dose because we're going to give it to somebody else in our organization, then I think that would be an opportunity to look at that and shed some light on that.
Excellent. Thanks, Doc. So just to clarify, this is not going to be a mandatory vaccination. Is it the thought, maybe this is best for John, is there a thought that we're going to see employers make it a condition of employment? And then
I can comment on that. So I think, so from federal down through the state, the messaging has clearly been non-mandatory. And truth be told, because this is under an emergency use authorization, I think it would be really hard for an employer to mandate it. But it is the purview of an employer. So, I think just like some employers require you to get a flu vaccine and others do not, theoretically, especially for private entities, they could do that. And, again, I think it would be risky, and I don't think anybody would do it, but, I would just put it out there. And, just to frame this, it took flu vaccine 20 years to become mandatory in most, healthcare. And I think, in the fire service, I still don't know if flu is mandatory or not. So it hasn't trickled across all of healthcare. But, I would encourage you to consider getting vaccinated.
Awesome. John, did you have anything to add, Mr. Nemec?
Hey, Jared, anything I would say to that, and we're working very closely with our legal department with respect to that M word as far as mandatory. There is currently case law that's out there. I'm not an attorney, and I don't want even to even try to act like one. But the biggest thing that both docs had said, they're both advocates. The three of us are advocates. A lot of this is going to come down to relationships with your fire chiefs, your administration, with health departments, with your local elected officials, state elected officials. If there was ever a time that you needed to have those relationships need to be enforced right here, right now. So part of this fact sheet, information sheets that the IFF is going to be sending out will include all that, Jerry, because at the end of the day, and I know that's an old saying most folks don't like hearing, but we need to ensure, you need to ensure that we are providing our members, their families, but our members first, the most up-to-date, factual, data-driven information that we have that we can inform our members as to why he or she should get that vaccine. So not to speak for Rob and Raquel, but we will say, I will say that our advocacy, our education, that we are going to step up, we are going to get the vaccine, but that obviously that needs to go to you all first. Whenever it's time for us to get it, you know, we will roll up our sleeves and we will go ahead and take care of the vaccine, but we want you all to be first.
Great. Thanks so much. Okay, so moving forward, I see Stevie's got a question. If you do know how to use the raise hand feature, oh wait, Rob, go ahead. I'm sorry, we'll get right back to you, Steve.
No, I just wanted to thank you, doctors, for that great information. That is key. And what we were talking before about the education program, and for you to do this is just phenomenal, because this is how we educate all members. And having your medical directors involved is going to be an important key for no matter what, even if it's going to be, if you guys need to go out and assist giving the vaccines, you know, having your medical director on board is going to be extremely, extremely important. I do have a question for you, Doc, because it seems to be coming up from over in Europe, that there's been some, I guess, allergic reactions to the shot. But from what I heard this morning from another doctor is that only if you really suffer from anaphylaxis should be the only real reason you shouldn't get the shot. But I just wanted to confirm that with the doc to kind of put people's minds at ease when they hear that going on.
Yeah, that's a great question. And so there's only been a couple of those that have been reported. So when you look at that over the denominator of the 50,000 people in the trial, it's an exceptionally low number. So there are always risks, and just like there are risks when people get flu, you can have reactions to the components of a vaccine. You know, I think that right now, we actually had a conversation this morning at the our SDMAC committee about this, and right now there's just not a lot of data in a couple cases. So I think overall that doesn't assuage me in one way or another.
Okay, Secretary Treasurer Wilding.
Thanks, Jerry. So Doc, the questions that I keep getting are there a difference between the two vaccines? Obviously, one is 2 injections, the other one is 1 injection, but is there a difference from a what happens, how long does it last, and what are the side effects of each one? Is there minimal side effects from one versus the other?
Yeah, that's a great question. So far, again, the data that we're seeing is fairly consistent with other types of vaccines. These are not live virus vaccines. These are messenger RNA types of vaccines. The amount, so the dosing different depending on whether it's a Pfizer or other. And what we don't know is, long-term consequences. How long will you be able to have immunity conferred? We don't really know that yet. These things have only been under investigation for a short period of time. I suspect this will be akin to flu. So I think probably it'll give you some brief immunity, and then probably, annually, maybe as virus mutates, we would have to have boosters or new vaccines every year or periodically. So I see that on the horizon, but I don't really know the data. The data doesn't speak otherwise at this point.
Dr. Kalala, is this something that they'd be able to put into your normal flu shot, or are you seeing multiple shots every year?
Yeah, that's a great question. I don't know the answer to that. Certainly, when you get a flu shot today, it generally is if you will, a cocktail of the ones that the CDC and others think are going to be the prevalent strains of flu. So that's sort of it's a roll of the dice, if you will. I don't know if future vaccines will allow for the same kind of combination or not. I don't really know at this point.
Just to follow up, Jerry, if some of our members have actually had COVID, do they still get vaccinated?
Yeah, I can answer that. So right now, so I think there's two ways to look at this. One is right now we don't know, because the populations that have had this, oftentimes were never exposed to COVID. So we don't know if having a COVID infection gives you immunity. I think how we're strategizing this at the local level is, if I'm a vaccinator program and I have a small supply of vaccine and I have 2 recipients, one of them just had COVID in the last 2 or 3 months and the other one did not, the nod will go to vaccinating the person who did not have COVID, because theoretically the one who did should have some antibody response. Now, that's a very nuanced sort of approach. But the guidance right now does not, at least the ones that I've seen, does not say if you've had COVID, you do not get vaccinated. But I think that's going to be a local strategy on trying to ration vaccine early on. I think once vaccine becomes much more available, then, I think it'll be just like, when you had flu, it doesn't mean you don't get the flu shot the next year, basically.
Okay, great. So I do have a raised hand from Andy Hargarden. So Andy, if you want to unmute yourself, and then for everybody else online, if you do know how to do that raise hand feature down in the participants option at the bottom. And otherwise, what I'll do is you'll pop your camera on like my girl Bridget just did, and I'll see you raise your hand. And at the very end, for anyone still struggling, we will just have you unmute yourself and start talking. So Andy, did you have a question?
Yeah, I did actually have a question for Dr. Weston. Hi, Dr. Weston. Quick question about the source that you used for the 40% of 18 to 35-year-olds having long-term effects. Where was that data, or where did it come from?
Dr. Weston, we're not hearing you, buddy.
How about that?
There we go.
Okay. I can get the data source to you. Maybe I'll email it to Jerry and email it to you, Andy, as well.
Okay, that'd be perfect. Thank you, sir.
Yep, thanks.
Thanks, Andy. Bridget?
Hi, everybody. Thanks for this opportunity. Couple questions for probably whatever doctor could answer. First of all, the effectiveness of the vaccine. I know flu's anywhere between 40 and 60. So I've heard higher for possible COVID. So the effectiveness first. Second, it's a 2-part dose. If you get the first dose and you don't get the second dose, is it null and void? And then if possibly talking about importance of PPE after you get the vaccine.
Yeah. So Bridget, first of all, hi. It's been a while since I've seen you. And those are great questions. So the first one is, let me go backwards. So getting the vaccine does not preclude you from taking any shortcuts on PPE. So for 2 reasons. One is, even though the vaccine is reported to be upwards of 95% effective, so that's the first question, there's still a small chance that you can get sick. But more importantly, you can, for a brief period of time at least, carry a virus that can infect other folks. So really, the PPE is a two directional mechanism. And then so those are the first and third questions. The second question about if you don't get the second dose, is it null and void? And the answer to that is no, because there is some immunity that comes with the first dose. But just like other vaccines that are scheduled, completing the series gives you the best chance of having your highest antibody level. And, again, some of these vaccines are 2-dose strategy. I think the ones that we're going to get, the Moderna one, if last I remember, is, and I don't have it top of my mind right now, but it is a 1-dose strategy. So that should be good for you.
All right, thanks, Bridget. You have a future in journalism. I think that those three questions all at once, that sounds like a press corps type thing there. Doc Colella, as far as the PPE question, just so we want to for sure educate our members that after their first series of shots, if they have the Pfizer version, they need it's business as usual with all the same PPE that's being worn prior to vaccine, right?
Yeah, and actually, whether it's the Pfizer, the Moderna, really like it, like PPE is in our future for, for a good period of time. So, and I would just remind folks, really your biggest risks are going to be the risks that you face in your firehouses when if you're not wearing PPE, and in your communities and families. Because I think, all of us have that. I think there's good discipline around wearing PPE when we're with patients. But I think the biggest risk that we see, and certainly if you look at the healthcare data, most of us are getting sick not from taking care of patients, but by the mechanisms I just mentioned before. So yeah, PPE is on the horizon for a while.
Hey, Jerry, do you mind if I go ahead and piggyback on what the doc just mentioned?
Yes, sir.
It's extremely key. And I believe we had said this on the last Zoom video conference about the big four: wearing masks, face coverings around the fire station, ensuring you're washing your hands, you're deconning the apparatus, you're deconning the station, not once, not twice, multiple times throughout the day. Making sure that you're doing self-assessments, at least twice daily, taking your temps. I know there's some controversy that's saying, well, a lot of folks aren't coming down with temperatures or having temperatures. Nonetheless, we're still advocating doing the self-assessments up to and including taking your temp at least twice a day. And then lastly, as far as social distancing, and there's a lot of pundits that are out there that will say, well, I've been wearing my mask and yet I still got COVID-19. Of the big four, that's not an a la carte. You don't pick and choose which one you would like to go ahead and actually practice. You need to practice all four. And I want to be very, very careful that we're not stepping out of our lane or stepping out of bounds here as it relates to what you do in your own personal life. But try to practice those four, the big four, when you're away from the fire station, at home as best you can. Whether you're going to a certain place of worship, you're going out shopping, whatever the case is, that you ensure that you're practicing the big four all day, every day to minimize your risk. And we are very excited, like you all, about this vaccination. But what are we doing up to and including once we get vaccinated? And then what are we doing once we get vaccinated? So we need to make sure that while we're really having this tunnel vision on vaccine, what are we doing in the meantime? One of the things on our website, we have a tracker, and that's for affiliate leaders to hopefully get on our website, coronavirus, and fill in as far as members who've been exposed, folks who have been, not only exposed, but may have been hospitalized, and the list just goes on and on and on. The unfortunate part is we've only had about a third of our 3,500 affiliate locals of the IFF actually participate in this tracker on our website. Nonetheless, right now we have 21 line of duty deaths. And these are all facts. This is all data that, again, you could send out as part of your education looking at the tracker. There's over 17,000 combined between being isolated and quarantined. Over 30,000 who have reported as far as exposures. 153 who have actually been hospitalized. So if you go to that tracker, you have the data there to show and tell our members, don't become another statistic. It's just like cancer and cancer deaths, and the list just goes on and on and on and on and on. So, while we're really focused on the vaccine and we embrace it, we're advocates for it, and we want you to get it. What are you doing up until, including you get vaccinated and then subsequently? All that still needs to be ongoing.
Can I just add on to that, John? Thank you for that advocacy and that message. It's so important. Jerry, I just shared with you a link from a New York Times article earlier this week. You know, all of us are familiar with that Swiss cheese model when medical errors happen. You know, well, how certain things are blocked at different levels. There's a great analogy on COVID, and it speaks to your points, John, about there are different layers. So there's not one foolproof thing, but there are different layers that when you use them together really help to mitigate the risk of contracting COVID. And I think in addition to those other things that you mentioned, those mitigation strategies, I think as rapid testing is becoming more available, especially outside of a normal healthcare model. A number of agencies are using rapid testing. And when I would have you think about, is this a strategy that works for your particular area? Because you are sharing a space for 24 hours. So is there some mechanism? I know that there might be some politics around that, but it might be something to think about as well. A lot of entities are doing rapid testing, as a strategy to mitigate infection. So I'll leave it at that.
And are we more confident in the outcome of those tests? Like, I know there's different versions that are rapid, that it is a positive, negative, and that it's actually not false.
Yeah, I mean, I think each of those have their sensitivities and specificities around them. I think some of them are fairly reliable, and I think using them in a staggered method. So on a 24-hour, on a 3-day cycle or something. So some of these are more effective than others, but it might be just something to consider. We could talk through the data at some point outside this. I'd have to refresh myself on it.
Okay. But it's definitely a tool for us.
Right. It's one more tool. But honestly, like at the end of the day, the simple things that we're all aware of, they're really effective.
Yeah. Thanks for that, Doc and John. Bridget, did you have another series of questions for us?
Just a follow-up.
Okay, thanks.
For something Dr. Colella said, you said following the vaccine, you could be a carrier. Weston said that it's not a live vaccine. So I just want to make it clarify. Can you get COVID after taking or getting the vaccine? People think that they can get the flu after. Yeah. So. Yeah.
So that's right. It is not a live virus vaccine. And yes, again, the effectiveness is really high. But there are, the data says 90 to 94%, depending on which vaccine trial you see, effective. So that means that there is going to be a subpopulation that it might not be effective in preventing COVID. So I think that there still may be a small risk that you get a vaccine and it may not be effective. Very small, but I think it's something just like flu. I think flu is a little different in that what you're really banking on is the right strain of flu in the vaccine and compared to what you're encountering in the community. But I think, COVID has not mutated so much where, the vaccine should not be, the vaccine should be fairly effective for the little bit of mutation that we've seen on this. So I think we're in a good place. Dr. Weston?
I was just going to say, just to clarify in case this is part of the question too. So the vaccine certainly cannot give you COVID or make you shed the virus or anything like that. All it does is it tells your cells to make one of the little spike proteins that's on the virus, not the virus, nothing that can be harmful, just so your body can then recognize that little spike protein. So nothing about the vaccine can give you the virus or make you shed the virus or make you test positive for the virus or anything like that.
Great. Thank you, docs. Thank you, IFF staff. I see the president is on. President Mitchell's been working extremely hard. So you want to just say hi?
Hi.
Any other questions?
We have enough doctors on here in order for me to speak. If we I have an honorary doctorate, so if you guys need another doctor, let me know, but I'll just let them speak for now, Jerry.
Thanks, Doc. Anybody else? We're going to limit this just to the COVID safety discussions and vaccine discussions. So is there any other comments before we break?
Hey, Jerry, it's John. Just real
Yes, John.
quick, if Raquel and Rob can just talk briefly about behavioral health as we go through this COVID-19 stuff, and then what our take-home message would be.
Yeah, that would be great. And to everybody that's on and who I guess isn't on, we are going to have this recording available as we do any of our safety chats. It'll be posted to our Facebook link related to the PFFW COVID-19 page. And feel free to share it. There's no secrets here. If you want to share this one with your chiefs or any of your members, it is 100% yours to use however you'd like. So yes, please go ahead, Raquel or Rob.
Yeah, I can briefly talk about the behavioral health information. So obviously on our website, we have a ton of behavioral health resources that our behavioral health specialists at the IFF have put together that are specific to individuals who are, in quarantine, going through this with their families, just dealing with, just in general, COVID in the station. There is telemental health resources there as well. And we also just want to promote, that there are peer support teams, your EAPs, that these are resources that you can really promote in your department or for anyone who is dealing with COVID themselves or dealing with it within their families. But this is definitely a really important issue and something that is often overlooked just because there are a lot of other pressing issues such as limited PPE and staffing. But this is something that the IFF is really highlighting, and we did want to make sure that everyone is aware of those resources.
Rob?
Jerry, just real quick, because you made mention that you're going to be sharing this link on your Facebook page and all. If ours allowed it, would President Mitchell approve sharing this link on our website as well so other locals can see it?
Yeah, definitely. As long as we haven't said anything really stupid.
We'll edit it.
I haven't been on the whole time, so sometimes Wisconsin we have a tendency to say some things that we want to keep in state. But as long as we haven't done any of that, yeah, that'd be great.
Everything's been extremely professional prior to your arrival, boss.
All right.
All right.
Well, that's all good, Rob. No problem, and John.
And I also just wanted to highlight that we are here as a resource as well. So if there are any other questions that come up about, distributing it or if members should get the vaccine, please feel free to reach out to us. We can do a number of reach out to the different docs that we work with and our partnerships. So did want to highlight us as a resource as well.
That's great. Justin?
Have we seen any success with members who have contracted COVID and were either seriously sick where they needed to be hospitalized, successfully get workers' compensation to cover those costs and that time off?
Who's that question for, Justin?
Anybody that's had anybody successfully get workers' comp. I'm not aware of anybody that's actually applied for it and been awarded workers' comp yet. So if there's anybody that has, if they want to reach out or speak up, that'd be great.
Yeah, if anybody does, just feel free to please unmute. If there's anyone that knows anything about the work comp, if any of our members have gotten sick enough to go through that fight. And we still, we're hoping to not necessarily have to explore this because we don't want any of our members to be so sick that they need duty disability, but we do still have in our legislation that SARS is one of the communicable diseases that we are presumptively covered for. So this is SARS, So we're hoping to not have to explore that, but please know that in Wisconsin, should one of our members be so sick that they need to retire because of COVID-related illnesses, we do have paths that we haven't had to explore yet, and haven't been tested since the legislation's been put in place. And did anyone have any answers for Justin at all on that question? Anybody been so sick that they've had to go off of regular sick time or their COVID time and be put onto get into a workers' comp battle?
Jerry.
Yes, sir.
I do have a little bit of information on that. I've been contacted by a couple people in Wisconsin, and have been working with them. Greenfield is the most recent case. And the city's been actually pretty good with him, trying to get him, he's got some fatigue and some lung issues, but they've been pretty good trying to draw it out and get him well enough to come back. But it's still kind of one of those pending long term. We'll see how this plays out in the end. So there is no definite things happening right now, but there is a case going on right now.
Okay. Yeah, we'll keep everybody posted on that. Dr. Kalala, are you able to pop on for just one more minute? I know you've got competing Zooms going today. I just wanted to, one of the wrap up pieces is just to, again, bring our members up to speed on what our big concerns are, in excess of the 14 days that they seem to think is the stop point for COVID. Just that they're making good decisions, not just based on, getting it and recovering quickly, or perhaps protecting others, but what this could mean for them deep into their career.
So if I understand the question, kind of the long-term implications of this, and we've highlighted a couple in the past, but I think the minor ones are these, sort of long haulers is the word that if you heard that in the media, where you have a lot of really vague symptoms from headaches and fatigue mostly, which are reported to be pretty debilitating. And a number of health systems are actually setting up clinics specifically for that type of thing. Some of the trickier consequences are going to be, lung capacity issues, and then of course the cardiovascular things as well. Myocarditis, heart failure. During the more of the acute and immediate subacute parts of this, there's a high risk of thrombosis. So you can get a DVT or a pulmonary embolism. So those are the other things to think about. So I think by and large, the members are generally a healthy population. So the odds are you should not get so sick with this. But again, there have been lines of deaths that have been reported in firefighters. So while the odds are good that you will do fine, I'm not sure if it's a risk I would take. And then especially as you're getting a little bit older into your careers, your risks. So your risks of, so it's interesting. There's if you look at the mortality for COVID, it's dropped down to about 1%. But if you stratify that based on decade of life, it can, every decade that you're older, your chances of dying are significantly higher. So I think it's just something to think about. And then of course, you don't want to spread COVID either. So anyway, I hope that was a long answer question. I hope it was on task there.
No, and just to confirm, John, what are we up to? 21 active duty IFF member line of duty deaths?
Yes, as of today, we're up to 21 line of duty deaths related to COVID-19.
And we're not talking retired folks or people that used to be members. We're talking about the people active on this call.
Active, yes, sir.
So that is other than, something like 9/11, have we had, I mean, and of course the cancers and stuff, but has there been an acute issue that has wiped our members out like this that you can think of from the past, at least our generation of firefighter?
Rob, you want to handle that question?
Nah, I mean, aside from 9/11, these numbers are quite quite concerning, because just these are just IAF members. In general, there's almost 160 first responders, line of duty deaths across the country in all different aspects of EMS and fire. So yeah, so that 21 number, although that's our number, but across the country and first responder numbers are extremely significant for this disease and sad.
And I would also say, Jerry, if you don't mind, like I would also say it's not just, I mean, deaths are certainly one indicator, but there's a morbidity piece to this that I think, many folks need to pay attention to. It takes you out of work. There's consequences long-term, and we don't know what the long-term consequences are yet. So, I think this should be concerning for us.
Yeah, absolutely. And I always go back to the herpes, conversation about, it was just a joke when I was in high school and stuff. And now I've had friends die from cervical cancer because of it. So, I mean, you just never really know, 10, 20 years later, what the deal is going to be from these viruses. And also, unless something's changed, it's a leading cause of death for police right now as well. So just overall, it's just an awful thing for us to be going through. And unfortunately, it's been politicized. So thank you for everything you're doing back at your locals to try to remove the politics and keep science at the front of this issue. Anybody else have anything? It's been a great hour. Thank you so much for staying committed to this and being part of this great organization, and to Rob and John and Raquel and Dr. Kalala, Dr. Weston, Dr. Mitchell. We really appreciate everything that you're doing in your locals to help keep us all safe. So thank you, everybody. And we will get the link out, and we will get any information that's been shared out. And everybody is welcome to use it and edit it however they'd like.